Welcome back, Warriors to Over 50. If you're new here, hit the subscribe button. If you like the video, hit the like button. Share this video with fellow warriors out there. Comment down below if you have any additional questions about what I talk about. And let's just go ahead and get started. So today I'm covering 3 questions related to Chiari that I've seen on the various boards on Facebook. So let's just get started. First one, what should you take to the hospital the day of your surgery? I'm not going to cover that in this video. Only reason being is I've already made a video about that. I already talked about the things that I took and the things that I wish I had taken. So I'm just going to put a link for that in the description section down below, and you can view that, at your leisure. So the next question related to Chiari is a pain management type question. Should you or should you not see if a chiropractor could help? Okay, I'm not a doctor, so put that out there, because if you watch any of my other videos, I've already explained someone had an issue with me saying you're not an expert. Okay, so I'm not a doctor, I'm not an expert, but I can tell you about my personal experiences with a chiropractor, and they didn't go well. I have herniated discs in my cervical and my lumbar spine. So my pain management specialist wanted me to visit a chiropractor because I'd gone through all the steps. I have a neurostem implant. I have the wires that go up and down my spine and connect to like a 10 unit battery in my hip, and I can control it, and it allows me to manage my back pain so that it's tolerable, so I can go ahead and work and I'm not just constantly in pain. So medication doesn't work, or sometimes I can use that instead of taking medication. Long story short, the chiropractor puts me on this table and drops the thing about a foot with no warning, and he starts pushing and poking and this and that. He broke the wires that connect from my TENS unit. The wires that go up my spine were broken. So basically I would be using my spinal stimulator, and I would reposition or change my position, and it would cut out. So it would cut on and off if I moved a certain way. So for that reason, I won't go back to a chiropractor. But to try to tie this into Chiari, which is why you're still watching this, hopefully, I just never, and my wife and I, we discussed this. I probably should have had her do this, join the video, but I didn't think about it until right now. But I'm not going to go ahead and do that. I'm just going to go ahead and put this out there. If you guys want to get her input, just drop in the comment section, and I can have her do that. That way you can get the caregiver, aspect, or get her idea about it. But we both kind of thought about it. What really can a chiropractor do? If you're herniated in your skull, how are they going to be able to manipulate your spine so that you're no longer herniated? I mean, first, there's no cure for Chiari. The surgery is more or less just to give you a better quality of life, and to, hopefully, you don't have to go back for a second surgery or additional surgeries. So for that reason, I just ruled out a chiropractor. I just don't think I had a colleague say, oh, you gotta go to a chiropractor. He gives me adjustments all the time. This guy's great. He brought me a brochure, and I was like, I took the brochure. I kind of already, had thought about it before he had mentioned it. I just don't see how they can help. So I'm not going to ramble about that. If you have any more questions about it, put it in the comment section. And I'm just giving you my personal experience with it. If you want to go check, I would check it out. Okay. I'm not saying don't check it out. I'm just telling you how I looked at it when I was checking it out, and I went ahead and just elected to go the surgery route, and I'm glad I did. My symptoms are almost, non-existent. Occasional dizzy spell here and there. I can't remember when I had the last one, so that means they're really not coming frequently. So I'm happy about that. The last question, or the third question, was when you go back to work, do you still have symptoms? Or should you expect symptoms? I wasn't exactly sure how this question was asked, so I'm going to go ahead and try to approach it, and hopefully I cover it. When you go back to work, think about this. You've been down for a while. And for the first 4 weeks, I eat, sleep, take meds, wash, rinse, and repeat, for about 4 weeks. for me, the pain and everything was so bad, I had to have my pain meds and my nausea medicine. I had to have both of those refilled. A lot of people don't have to do that. I was told that, because of my age, being over 50, hence over 50, because of my age, that's why it took me longer to heal. And that's probably why I was having more of the pain. So, but when you're down for so long and you go back to work, if you try to jump back into work like you were functioning before you had the surgery, and of course, maybe you were having so many problems functioning, everyone's Chiari situation is different. A lot of you out there have, I think, a more, I don't want to say a worse condition, but you guys have it rougher than I did. Okay, so, but when I went back to work, I was like trying to just, like I hadn't, just day one, I'm going back in, doing this, because I had to pack my room up so the custodians could come in and clean for the summer break. And I had to slow myself down because, I'd get going, and of course they turn the air off to save money. So, I would push the button to try to turn the air back on, but it was only keeping the room at like 79 degrees. I think it was more like 80. And as I mentioned in a previous video, for me, my symptoms were amped up the hotter it is. So like, so with my room, the AC not really running like it should, I had a couple dizzy spells. I was like, wait a minute, this isn't probably supposed to happen. So I talked to my doc, and he was like, well, you got to remember, you're going back in, and he's like, pretend you're an athlete, okay? And, like you've been out of, you've been nursing an injury. They're not going to just put you like right back, like say you're a baseball pitcher. They're not going to just stick you back in the rotation on your first day and tell you, okay, here, pitch 7 innings. They're going to give you, they put you out in the minors, let you work with, the AAA club, throw a few pitches. They put you on a pitch count. He told me you got to sort of do that with yourself when you return back to work. So, your employer needs to know that you're coming off a major surgery, and that, it's going to take you a little bit of time to get back to where you were before the surgery. And I hope that's making sense. For me, I just, I was having a lot of dizzy spells, but I was still able to do my job. So, when I walked in the door, I tried to do everything like I, hadn't missed any time. So, due to the heat and all that, I had a few symptoms. So that was my experience with that. Will that be your experience? I don't know. I mean, we're all different. So I hope I addressed that question correctly, and I'm trying to keep this video short, and I'm continuing to ramble. So we're going to go ahead and cut it off there. Again, if you're new, hit the subscribe button. If you like the video, hit the like button, because that lets me know that what I'm doing is helpful, at least. Drop questions down below. I'll go ahead and select a video for you that I think you might find interesting. Check that one out. Until next time, warriors, stay strong, and send questions if you got them. Take care.